Good morning and good afternoon, everyone. Oh. Thanks, Dr. Zelko. We have a special guest today, but I'll just start it out. I want to start by saying hello to everyone on the line. I'm Jamie Parrott, Vice President and Chief Operating Officer of MedResults Network. And I want to thank everyone for making it out to our presentation today, including Dr. Zelko, who's on the line with me. Because we have a longer presentation today, we're going to run probably about an hour. I'd like to dive right in instead of doing sort of a typical intro that I normally begin with at the beginning of every webinar presentation. So to start, I just want to say earlier this year, if you didn't see it, we sent out a 2-question survey to our network and asked our members what type of education they wanted to see in 2018. And we asked about both webinar content and live trainings. And what we found was really interesting. The results showed that our members really wanted to learn about marketing and also new treatments and procedures. That was really important to our members. And then for live trainings, it was, again, more treatments and procedures and full facial rejuvenation. So we've tried to tailor our education this year around what our members asked for. And knowing that they were extremely interested in learning about new treatments and technologies and procedures, we decided what better than to look to our experts for information on the latest and greatest procedures in the industry. And so we turned to our members. And this was kind of the genesis of our mini webinar series, which we call Advancements in Aesthetics. And today is our very first installment with our longtime member, Dr. Timothy Zelko of Zelko Aesthetics. So to introduce our special guest presenter, Dr. Zelko, he's been a member of the network since 2013, and he has had a very interesting path to becoming a cosmetic surgeon. Dr. Zelko was originally an OBGYN for about, 23 years, and he eventually changed his practice focus in 2006 to cosmetic surgery after he embarked on a quest to study with some of the best experts in cosmetic treatment. So I'll let Dr. Zelko share a little bit more about his story and how it led him to become one of the most successful Tickle Lipo providers in the U.S. And that's one of the key things we're going to be talking about today. For those of you who've never heard about the procedure called Tickle Lipo, you are really in for a treat. Over the next hour, Dr. Zelko is going to share more about this innovative procedure, which is safe, it's comfortable, it's effective, and can produce the same results as more invasive liposuction procedures. He's also going to go over what the procedure entails, what it will treat, how to combine it with other treatments, and then, of course, how to become successful with the procedure in your own practice. So, that I think the key piece of this, too, is also his step-by-step approach for identifying ideal candidates for this treatment, and then, of course, how to develop a comprehensive treatment plan for those patients. So before we begin, one last reminder. After the end of the presentation, a 4-question survey is going to pop up to get your feedback about today's presentation. If you could fill this out for us, we would be extremely appreciative. And it's going to give you an opportunity to ask any questions you may have for Dr. Zelko or any questions you have about procedures. And with that said, I would like to introduce our special guest speaker and expert, Dr. Zelko of Zelko Aesthetics.
Well, thank you, Jamie. Thanks for having me. And thank you all for being on the conference call today, the webinar today. So before I start, I want to just preface the conversation by saying that the way I'm going to present this is going to be more from the standpoint of presenting it, say, to a patient, how I talk to a patient, how I want them to understand what I do. And I think all of us as practitioners really want to be empathetic and understanding of our patients' needs. So I really wanted to kind of approach it from that standpoint, so you have a better and easier, I'm sure you already do, have an easier way of presenting this, understanding this from the patient's mindset. So with that said, we're going to start our innovations in body sculpting. And one thing that we hear, and we hear a lot of during the procedure as well as afterwards, is the statement or the question of, why didn't I do this years ago? Because so many patients actually love the results that we could achieve for them. Now, I just want to ask a question or two before I get started here. When you hear the term liposuction, most people I talk to this about, the first thing is this playing this horrific movie in your head about how bad liposuction is, how bloody it can be, how it's not a good positive connotation. But I'm here to show you today that there is a spin on this that is much more gentle, much more safe, and is effective, if not more effective, than any liposuction procedure you ever received before. And I'm going to present this in a way, and again, that talks more as a patient or to the patient than just to you as a practitioner. So I hope you understand and hope you like the way this is being presented. Any feedback that you can give Jamie regarding this presentation, I would appreciate. So with that said, we'll begin. So on today's agenda, okay, what my goal for you today is that I want you and your patients to gain confidence right now in a possible procedure that they're very unsure of. I want you to be clear about this procedure and what it can do versus confused. The internet is full of contradictory information, and I really wanted to hopefully kind of settle the dust so you can understand better about what body sculpting really is about when it comes to more significant body sculpting. And I want you to become certain, or right now you probably have a lot of doubt about what it can accomplish, and dispel the despair and have hope that there is truly an answer out there for people who want and need some body sculpting. I want to unlock within you a true potential, or your patient's true potential, to take control over their lives, okay, to make a significant advancement towards a better you, or a better them, if you will. Because as we age, we still feel our best years are yet to come. But what I need from you, and basically really from what you need from your patients, is a desire to implement what is told them. I don't know about you, but I see it daily in my practice. I'll see consults, I'll see patients coming in, they're bothered by something, they share all their inner feelings about what really upsets them. You know, their lack of self-esteem, their lack of self-confidence because of something wrong with their bodily image or even their face, okay? But they are looking for an answer. And we assess them thoroughly, and we give them an answer, and yet they do nothing about it, okay? And they come back years later, basically still clinging hopelessly to their problems, which is very, very sad. So I want you to take an active role today. I will hopefully want you to learn something today. Ideally, after I'm presenting this presentation, I want you to say, oh my God, here are all the answers that my patients need. But realistically, I want you to understand the options. And most importantly, I want you to challenge me. If you doubt anything I say, please feel free to question me. Through Jamie's questionnaire, I will be able to clarify things for you if there is need for clarification. So hopefully we have a deal, we can move forward. So just a little bit about me so you understand where I'm coming from. As Jamie said, I'm an OBGYN for over 20 years. It seems like a long, long time to do OB. Many, many years in the hospital, many, many deliveries. But what I heard, again, daily in my practice is the anguish of patients who love the baby that they have, but they feel like the baby just destroyed their bodies. Or also they woke up one morning after menopause and said, I got this. I don't know where it came from, but now I got this. And I'm in menopause. And I felt kind of helpless to figure out what I can do to make them feel better about themselves. So what I said to myself is that wouldn't it be nice to offer these women a solution that really worked, that delivered a result that they could be proud of, that would enhance their self-esteem, their self-confidence, their self-worth, and really truly help them to appreciate themselves once again. And ultimately, if you appreciate yourself as a human being, you're going to take better care of yourself. You're going to be a healthier human being. So my opportunity to get into this space came about 12 years ago. I had a mentor in the form of Dr. William Say. But Dr. Say, his claim to fame is he was the one that took the open gallbladder procedure to a laparoscopic gallbladder procedure. He perfected that. But he also became a consultant for a company called Sound Surgical back in the early mid-2000s that had the Vaser ultrasound technology. So he's the one that got me involved with liposuction to begin with. But my challenge over all these years is that I performed thousands of procedures now over the last 12 years. I've done tens of thousands of hours of work over the last couple of years, but I was always looking for the best body contouring solution, okay? Something that was the safest, was the most effective, and delivered the best result in the shortest period of time for my patients. So I went on a quest. As Jamie said, I did study with a few experts. Back 12 years ago, I studied with the Vaser experts in Denver, Colorado. One of the best plastic surgeons in the world was there. His name was Alfredo Hoyas, and he actually practices out of Bogota, Colombia. He is by far an artist when it comes to cosmetic surgery. I studied laser lipo, which is primarily smart lipo back then, with a doc in Phoenix. I studied traditional lipo and Avelar tummy tucks with another well-respected physician surgeon in Philadelphia. I studied body jet, also known as water lipo, in both two national experts, one found in Dallas and one found in Orlando. I went to Belgium to study Tickle Lipo, and I studied advanced skin tightening procedures in Colorado, both in Fort Collins with the body type procedure and in Denver recently with J-plasty. And my conclusions from all this is that Tickle Lipo was by far the most superior form of liposuction, and J-plasty, which is a trademark given by the doctor that developed or looked at J-plasma, which is the true technology out of a company called Bovie, was by far superior as a form of skin tightening. So Tickle Lipo, it's also known as NIL in Europe. It's been around for about 20 years, coming out of Belgium. And NIL stands for Nutational Infrasonic Liposculpture. Nutation is just the rotation of the tube. You have a handle that causes the cannula to rotate. And as it rotates, it vibrates at a very low frequency, therefore infrasonic vibration. And in Europe, this is truly called liposculpture. They don't call it liposuction in Europe. They call it liposculpture because it is truly a sculpting apparatus. And it's been in the U.S. about 10 years now. And I've had it for about eight and a half of those 10 years. J-plasty, on the other hand, is very new. It just was basically discovered in 2016 by Dr. Jack Samora. He put his trademark on and called it J-plasty. It's really J-plasma from Bovie Corporation, which was developed for other reasons surgically to destroy endometriosis and destroy cancer cells through a laparoscopic procedure. But he found because it's so safe that you can actually use the same instrument to tighten the skin subdermally. It's highly effective and a very safe skin tight procedure. And I was just with Jack last week. So again, just to speak to my expertise and someone authority in the space, I studied all forms of liposuction and skin tightening. I've actually trained doctors in both Vaser and laser and Tickle Lipo. I have performed over a couple thousand cases. I actually own the Tickle Lipo brand, and I'm one of the first doctors in the Midwest, at least, to do J-plasty. So where's my proof that Tickle Lipo is the best? Well, you can see my patient results, which I'll be showing you. You can go to the website. You can hear their video testimonials. You can read the written testimonials, and they all speak to how happy they are with their procedures. So just to give you an example of some of the patients that we've done recently, and these are all my patients. These are not stock photos from some other company. This patient actually, I thought obviously her after is on the right, her before is on the left. She was a patient that bicycled in Chicago downtown routinely in the evenings, but she felt, even though she had a very nice curvy body, she felt it was poofy, and she wanted those poofs to not show up that much on her tight bicycling clothing that she wore. So she wanted to be kind of feathered down and shaved down to have more of a sleeker look. And we gave that to her. You can see the two little small incisions on the lower groin area. So she's about 10 days or 2 weeks out. So it's a nice symmetrical, smooth result from a patient who pretty much had a nice body before we started all this. Other patients that we've done in the recent past, and it just shows that we can get symmetry for these patients. We can keep smoothness for these patients. We don't see the irregularities, the rolls and waves that are done with more aggressive forms of liposuction. Here's patients from the side, again showing a nice flat belly and nice accentuation of their flank area. We have our patient from the side as well. Again, these all patients are very, very happy with minimal downtime. So my typical objections, which are probably the same objections that you have in other procedures that you do in your office, is one, the fear. It's the fear of the unknown. How bad is this going to be? And the nice thing about this procedure, it's a very comfortable procedure. So what I shoot for within their first 2 to 3 minutes of the procedure is I want them to say something to the effect of, is this all there is? My dentist is worse. My tattoo is worse. They are very much relieved because obviously they come in anxious. They don't know what to expect. And within minutes, they're saying, oh, okay, go on. But we just basically talk. Our room is dimly lit. We have music playing. Our bed is heated. We have aromatherapy going. And, we're just trying to make this as comfortable and as relaxed as possible during the whole procedure. Postoperative pain-wise, most of my patients just have like a deep achy soreness. Like it did a relatively severe workout at the gym, and they're just going to be sore for a couple of days. The downtime is minimal, sometimes none, 1 to 2 days. Again, give the example a lot of my patients. That I had one patient, she came in for her abdomen 1 week. 7 days later, she was coming in for legs. In between, she bicycled 50 miles twice because she's an avid bicyclist. Another patient flew in from Boston, had a procedure done as soon as she hit the office that morning after flying from Boston. Went home that night on a full flight. Was going to be back in the office the following day, but unfortunately, her friend was with her that lived here in Milwaukee. They went out drinking before she hopped on the plane. So a little bit of alcohol, a little bit of Valium, or just start to say a little bit of Valium and then a little bit of Tylenol with codeine didn't sit very well for her. So she had a stomach upset the next morning and couldn't go to work. But otherwise, that was only going to slow her down. Cost is, I'm sure you see the same thing. Cost is a typical objection that everybody has. We're in the Midwest here, so it seems to be even more pronounced than maybe on the East and West Coast. And I think that's unfortunate because that's a lot of times the lead question that we hear in the office. It's unfortunate because we haven't done a good job of educating these patients. We haven't educated them well enough to understand how we are different, what we do is different, and why they should not just compare us apples to apples to everybody else in the marketplace. And then for results, again, they're also asking for results. So we have the website, we have before and after pictures, we have the testimonials. And typically effective and authentic testimonials are by far the best way to eliminate these objections. So again, my promise with you today is to deliver information that hopes makes you think about what you should do with your practice when it comes to body sculpting. Hopefully it will stimulate possibilities. Hopefully it will confirm to you that Tickle Lipo and J-plasty are really unique and true answers to a lot of patients' problems, and give you the confidence for your patients to take action. And again, challenge me, ask me questions if you doubt what I have to say, please. So okay, if that's okay with you, then let's go forward. My defined outcome for you again is to give you help you make a well-informed decision whether body sculpting is the right thing for you or for your patients. Furthermore, I want to help you kind of self-diagnose and prescribe what is the best treatment when it comes to a given problem. So typically we go through a step-by-step approach with our patients. I have a lot longer presentation I give when I'm going directly to patients, but it boils down to whether you're a candidate or not. What's your assessment? From there, your assessment, what we give you as far as a diagnosis or a label. And then from that diagnosis, what is the best treatment option for you? And then what's your results and recovery going to look like? So I always ask 3 questions when a patient comes in for a consultation. The first one is, what are you looking to achieve? What is your defined outcome? What is your ideal result? When we have that answer, then we ask you, well, what are you willing to go through to get there? And finally, how much are you willing to spend to get there? Because that also will dictate what kind of procedure will be offered to them. So their desired result is equal to their expectations. But the big question is, are their expectations realistic? The patient's coming in saying, I want to lose 20 pounds with the procedure, or I'm a size 18 today, I'm looking to be a size 6 tomorrow. Those are not realistic results. For the most part, one, we don't do patients that are just looking for weight loss. This is not considered a weight loss procedure. This is considered a body contouring procedure. Your scale will not be dictating what your success is. It's how you look and how you fit clothes will kind of tell you how successful this procedure has been. Am I a candidate? Well, first thing I also tell patients is, well, if there's something to pinch, if I can pinch some fatty tissue between my fingers, then there's something to do. If it's just all skin, yes, there's still something to do, but it's not just lipo. So with a pinch test, I'm going to assess the skin laxity, how loose the skin is. When I touch the skin and move down to compress the fatty tissue, how much movement of my fingers do I have before I hit fatty tissue resistance? That we call the skin laxity. Once we hit the fatty tissue resistance, that's the fat thickness, and that tells me how much fat there can be removed. And then finally, some patients just have a lot of draping. Those who have lost a significant amount of weight, their skin will start to drape down into their lap. It's unfortunate these patients, think, God love them, they're losing the weight, which is good. It's good for their health, but they keep on waiting for that skin to just suck in, pull in, and be gone. Unfortunately, that fatty pinch of that draping tissue just gets thinner, and unfortunately just begins to hang lower. So they never get the result they're looking for, and even though they have lost the weight, the scale has now changed, they don't see a nice result in the mirror. So based on that, we have a diagnosis on our assessment. If there's only fat, we do one thing. If it's skin laxity, we offer another thing. If it's fat with mild laxity, we'll offer something else. And then finally, there's fat with severe laxity. Each of these diagnoses will dictate different types of treatment. If it's fat only, we recommend Tickle Lipo. If it's skin laxity only, we'll either do J plasma, or depending on the degree of that skin laxity, a tuck might be better. If it's fat with skin laxity, then we're going to be starting combined procedures. We're going to Tickle Lipo with J-plasty. In this office, we call it the tickle type procedure. If we're going to do more significant skin removal, then we're doing Tickle Lipo with an Avelar tummy tuck. In this office, we call that a tickle tuck procedure. If the fat with severe laxity is there, then it's basically going to be a tickle tuck procedure, or depending on their needs and their wants and what they want to see for a final result, we may tell them just to have a full-fledged abdominoplasty, which requires general anesthesia. If I didn't tell you before, what we do in the office here, everybody is awake. Nobody goes to sleep, so it's a full-fledged abdominoplasty with a muscle oversew and things like that. I can't do it in an office-based setting. Treatment options, basically we're looking to see what your ideal result is, again, what you're willing to go through to get there, willing to spend, and now we add the assessment, the diagnosis to prescribe what the treatment is, because there is no one-size-fits-all treatment plan. Everybody's individual. Non-invasive procedures, time for different talk. Now I just want to go through the invasive side, which is the liposuction, why and how Tickle compares to everything else. So invasive liposuction procedures are multiple. There's traditional, which is typically that horrific movie everybody plays in their mind. PAL, which is just power-assisted liposuction, because liposuction traditional can be quite strenuous on the surgeon. It's a lot of hard work. We're sweating like crazy. So in order to minimize that amount of effort, you can powerize the instrument for traditional liposuction, therefore PAL. VASER is what was taught 12 years ago in Denver. That's ultrasound-based liposuction. Laser, which by far the most common laser is Spart lipo. Body jet, which is also known as water lipo, and Tickle. These are the main types of invasive liposuction procedures. So the world of lipo versus Tickle. Everything out there except for Tickle is either cutting, which is sharp, and chunking of the tissue, or burning, which is significant heat and destruction of the tissue. Tickle lipo is different. There is no sharpness, there is no burning. We're taking that instrument I told you is rotating and vibrating, and we cause emulsification or liquefaction of fat, and we're just removing it. So cutting and chunking procedures, the ones that do that are traditional, PAL, and if you didn't know before, both VASER and laser also do cutting and chunking. Burning and destroying is the VASERs and the lasers. And then again, like I said, both is VASER and laser. What a lot of doctors who do these procedures won't tell you is, yes, it's a three-step procedure when it comes to VASERs and lasers. We want to numb you, then we're going to either VASER, ultrasound you, or laser you, and then we're going to suction last. So the VASER and laser are causing that heat and destruction because of the heat and burn, because that's excessive heat. And after that, the suctioning is usually using a sharp instrument. So it's what's called an evulsive cannula. It's cutting and destroying more tissue. So you can have a double whammy of burn and destroy and cut and chunk, which causes for a lot of downtime, a lot of pain, and a longer recovery. Body jet or water lipo comes out of Germany originally. It's a high-power pressure, basically washer that sprays fluid in to numb you, and then continues to spray fluid as we're suctioning the fatty tissue off. I used it for 2 months and got rid of it because I couldn't stand it. It's a very uncomfortable numbing process. You're taking this water that you're spraying against tissue that is not numb to make it numb. So the patients I want to become relaxed and just taking it easy with the first few minutes never did with this. They were uncomfortable throughout the whole numbing process, which could take half an hour to an hour just to numb them. And then you start to suction them. You're spraying more fluid while you're suctioning. So it was just a very cumbersome type of liposuction that I didn't see benefits of. Tickle lipo, you're probably wondering, why we call it tickle lipo. Hopefully you can hear this. Let it go. So that's one reason why they call it Tickle Lipo. Here's another one, another patient that we had. So there's a very good reason why it's called Tickle Lipo, because patients truly do feel tickled during the procedure. So one, we're getting you comfortable, we're getting you numb comfortably, and then during the procedure, occasionally we're tickling you, and some patients are laughing quite loud and out loud. I occasionally had to stop for patients to catch their breath because were laughing so much. So anyway, why is Tickle Lipo superior? The infiltration process. The first thing that we do to the patient, we have to get them numb. I want to get them numb comfortably. I want to have them basically feel, all they feel with my numbing procedure is they feel the vibration. They feel some of the fluid pouring in leak back out so they feel wet. And occasionally as the fluid stretches the tissue, they feel a little pinch. But other than that, again, all they say is this all there is? And they'll say, my dentist is worse, my tattoo was worse. Adding to that vibration rotation, or what, again, in Europe they call that nutation, is what's called a gating mechanism. A gating mechanism is a way for our body to block the sense of pain or discomfort as it leaves that segment of our body and travels back up to the brain. So this vibration rotation actually helps to further negate any sense of discomfort. And the tube that's going through to numb you is only 2.5 millimeters in diameter. Again, it's blunt, it's not sharp, it's rotating and vibrating, and typically finds a path of least resistance to go through the tissues to numb you. So it's a very, very comfortable numbing process. So again, the anxiety level of my patients drops dramatically within the first few minutes of the procedure. And I'm dripping the fluid in to numb you. I'm not spraying in, say, like the normal procedures that are done with everything else. A cannula is put in and just blown into the tissues to numb you. Most of the time, it's a very uncomfortable numbing process when it comes to everything else in that list I told you about liposuction. As far as emulsification liquefaction, we're using a blunt cannula during the suctioning process. There is no sharp edges to it. There's no heat generated by it. And what it basically does is selectively emulsify the fat so we can remove that fat. Okay. The anesthetic fluid tends to remain behind, and we tend to get out only the fat. It's very easy then to contour and sculpt with this instrument because we're not chunking it out. And the vibration rotation, again on this side, also acts as a gating mechanism to further suppress any discomfort. So there is no cutting, there is no burning. Fat fluid ratios and how much you get out during a procedure. Okay, pardon the picture here, but this is a little graphic as far as what we get out for fat versus fluid. So you look at this, you have what's called the fat, which is on top. Another fancy term for that is a supernatant, and the fluid on the bottom, which is the infranatant below. The fluid is only the first 200 cc's, okay, at best, and the rest of that from 200 all the way up to about 2,300 is all fat. So that's 2,100 cc's of fat to 200 cc's of fluid. That's a 10-to-1 ratio. Everything else I used to use in the marketplace for doing this, at best I get a 70-30 ratio fat to fluid. Most of the time 60-40, and with a body jet, which is probably the worst, I get a 50-50 or even 40% fat, 60% fluid, because there was so much fluid being used during the procedure. If you think about it, you want the fat out. Okay, that's the whole purpose of the procedure. But ideally, you want the fluid to stay in to keep you numb. This does that. Nothing else in the marketplace works like this. So again, more pictures just showing you kind of results that we can get this procedure, and the fact that there's symmetry, the fact that there's smoothness. Patients, about 2 weeks out with this procedure. Same with that one. This one's only 1 week out, so she's still a little bit more swollen. We have patients from the side. Again, you can see the little marks where we did the incisions. You can see backs. We even do guys. Okay, but the thing with guys, I always kid guys about the fact that they haven't had any discomfort in their lives. Typically, unless they busted a bone somewhere, they don't know what pain or discomfort feels like. So women have periods, women have babies, women go through other reasons to have pain that they have no control over. Men have nothing. So I always compliment a gentleman when they have procedure done and they're just talking and being nice and calm. They took it like a woman, okay? Because men can be a little more hyper than women when it comes to these kind of procedures. There's just evidence for the sculpting. Okay, what we can do is we can etch out. Okay, in this one we're etching stretching out the triceps muscles so you can see that more thoroughly. You can see a little elevation of the biceps post-procedure on this patient. We unfortunately took the before picture after I drew on her before we did the procedure, and so that's where the marks are there. Here's another person. You can see that on the left, her arms are relatively puffy, okay? You really don't have any definition there. But on the right, you can see biceps definition, you can see deltoid definition, you can see triceps definition. This procedure truly sculpts the patient like nothing else I've ever used. This patient wanted her belly done, but then she also wanted her saddlebags done. So we did, obviously, the before picture on the left, 1 week out from her abdomen. You know, it's tape is still on, so we went ahead that the following week and did her saddlebags. Then she came back in 4 weeks from the second picture to take her post-op picture. You can see that's a pretty decent result for just lipo alone. Yes, she has a little bit of draping, but she didn't want a tummy tuck, so we got that result for her. And you know, from day 1 to day 42, she's just quite happy. Another person with saddlebags. Again, it just helps to show that we can sculpt those areas. And now going on to, once you know, showed you what Tickle Lipo can do, now I need to kind of give you a little idea of what J Plasma can do. Okay, J Plasma is produced by a company called Bovi. If you've ever been in an operating room before and or worked in an operating room before, you know about a Bovi machine. Bovi machine is what we use to cauterize blood vessels and do some dissection occasionally in certain tissues. So we used the Bovi. Well, Bovi bought a technology approximately 5 years ago and has been perfecting it primarily to do it. They call it the technology J Plasma. And it's a helium plasma that helps to coagulate and ablate soft tissues. That's what it was initially decided to be used for. And it's used for both open and laparoscopic surgical procedures. But like I said, Dr. Zamora decided to try it out for skin tightening and was amazed at the results that he got with this. So now, over the last year or so, J Plasty, the trademark of Jack Zamora, is being used more and more across the country to help tighten skin. So again, J Plasma is a minimally invasive skin tightening device we use through the same incision that we do our Tickle Lipo procedure through. It's a radiofrequency current coupled with helium gas. The radiofrequency current heats the gas and changes a portion of it to plasma, 1/10 of 1%. Okay, so 99.9% stays as helium gas. What 0.1% goes on as plasma. Plasma and the RF current helps to transmit heat through the tissues to take what's called the skin support structures and heat them and tighten them. If you think about plastic, when you heat plastic, it shrinks. The same thing with the skin support structures, they will shrink. You can easily do this under local anesthesia. It does increase the downtime from the lipo procedure, and you'll see some initial results, immediate results, but there's just ongoing results continue to occur over the next 3 to 6 months. So this kind of is an illustration of what's going on. The J Plasma cannulas coming in from the right. Those little stringy structures are the fiber support network that tethers the upper side of the skin to the lower side of the muscle, what's called the fascia. And this J Plasma is when the current goes through the tissues, strikes the fiber support network, heats it, and shrinks it down. And it moves throughout the tissues, doing this both superficially and deep. So with multiple strokes, you can shrink those tissues down. This kind of depicts what the helium gas is doing that does not go to plasma. The helium gas actually is cooling the tissues around all this, so the tissues aren't getting warm. If I were to put a heat gun on the skin where I'm working with J Plasma, the skin of that area actually stays cooler than the skin where I'm not working. That's how safe the procedure is. So again, we use J Plasma and we use Tickle when it's indicated for some mild to moderate skin laxity issues with fat. But if you have more moderate to severe skin laxity issues, then we go on to what's called an Avelar tummy tuck. In our office, we call it Tickle Tuck. It's a less severe form of a tummy tuck. Okay, it's differentiated from other tummy tucks because we do not oversew the muscles, and there's no movement of the belly button or umbilicus. We move extra skin primarily from below the belly button. These patients are again all awake with local anesthesia and just some oral sedation. And typical downtime is about 5 to 10 days. These are examples of some patients. This patient is approximately 2 weeks out from her procedure, and all she wanted was that lower draping skin to go away. She was much happy with that. She didn't really care that her belly wall was flat as a board. She just wanted that draping gone. There's another patient similar to previous patients. We have This is about 2 weeks out as well. And this patient also had both lipo and a tummy tuck as well. This is the one that we did live on Facebook a few months ago. She's doing very well. Here's a fresh one. So you can see what sometimes the incision look like. That's only a week out. We do large patients. This patient, again, just wanted that draping skin gone from below. Okay, wanted her upper belly a little bit smaller. So this is, again, 2 weeks out, and she's extremely happy. She didn't want to go through all the extensive abdominoplasty. So another patient, again, with a large pannus or draping skin from below. She wanted that off her lap. Okay, she wasn't looking to have a flat, solid belly with no curve whatsoever. She just was looking to get that draping gone. So not only do we do those lower tummy tucks, okay, with lower skin, but occasionally there are patients that have more redundancy of the skin above the belly button, okay, and they really the only way to get rid of that would be to do a traditional where you're going to cut the belly button out, pull everything down, take the extra skin off from below. But a lot of patients, one, don't like their belly button touched. Okay, they don't want to see a different looking belly button because they've seen pictures of people with abdominoplasties and it doesn't look normal. Okay, a lot of patients don't need their muscles oversewn, don't want that downtime of the pain of being walking over and stooped over for 2 or 4 weeks because they can't stand straight up because the rectus muscle oversew. So tickle can be performed on the upper belly first to kind of loosen that skin up. The skin is removed again just under local anesthesia, and incisions are staying underneath the bra area, or underneath the breast area, in the inframammary crease, and can continue over to the lateral side of the chest wall under the bra area to help accentuate the curvature of the flanks. Here's a patient. I apologize. The before should be on the left and the after should be on the right, but obviously it's not here. I mean, she had redundancy of the skin, and really everything going up would do a better job for her than everything going down. This lady is 62. She's a retired CPA. Her husband still works. She loves to travel, loves to go to the Caribbean, loves to be on the beach, but didn't want to be on the beach with the body on the right. Okay, so we talked about it and said, well, we can do something better for you. I believe we do a reverse Avelar tummy tuck, and she was all over it. Had it done, and now she's very happy to be on the beach with that body. And so when we lay her down, you can see the incisions under each memory fold. They're all nicely hidden, and we carried out to the side a little bit so we can give an accentuation of her flanks that you see again back here on the left-hand side. So again, she's very happy, and this is a 62-year-old lady that's now running around in a bikini again because she doesn't have the lower abdominal incision that she has to hide with some kind of crazy lower brief. But when push comes to shove, a patient really needs abdominoplasty. Okay, we'll tell them what that's all about, but then we're going to tell them that we're going to refer them out because they're going to need their muscles oversewn, but they need general anesthesia. They need their belly button moved, more comfortable in general anesthesia. They'll need drains placed, and they're going to have excessive downtime, sometimes weeks, occasionally months. So recovery results, what the patients expect. Typically, recoveries include drainage, discomfort versus pain, compression garments, activity level, medications, and return to work. So drainage, Tickle Lipo sets itself apart from everything else. We have minimal drainage with Tickle. For the first 4 to 6 hours, the day of the procedure, we told them we could be very soggy. The fluid we put in, we saw that very minimal came out during the procedure. Well, it's going to run out like crazy post-procedure. So for the first 4 to 6 hours, you're going to be very wet. By 12 hours that night, it'll be slowing down considerably. And by 24 hours the next day, 95% plus my patients stops totally. So again, to minimize the probability of returning back to work, if there's no drainage there, that helps return back to work more quickly. Everything else as far as drainage that I've had in the past lasted for days. As far as discomfort versus pain, as the anesthetic fluid runs out, their sensation is going to return. Like I said, with Tickle, it's kind of a deep, achy soreness, like you just did a very aggressive workout in a gym. But other forms of liposuction, it can be moderate, or it can be quite severe depending on the aggressiveness of the procedure and the aggressiveness of the surgeon. Again, remember, we're cutting and chunking, burning and destroying tissue. There's a lot of damage to tissue that does not mean to be destroyed, but the damage to that tissue causes a lot more sensation of pain back to the brain. Compression garments, again, Tickle, we only have them wear them for a week. It's more to express out the anesthetic fluid we just put in and help minimize the postoperative swelling that occurs for that first week. Every other form of liposuction that I used in the past, I would tell you keep it on for a good 4 to 6 weeks. because we destroyed a lot of skin support structures, that fiber support network, we had to keep that garment on and make sure that the skin stayed where it should stay and not move somewhere else as it was healing. And for us, for Tickle, it's as tolerated. Most of my patients, can go back to doing pretty much anything they want to within a couple of days. Okay, I always want them I want them minimizing their flexing of their belly wall, if we do an abdomen, just because it's going to cause a little bit more swelling discomfort if they do that. Not that they say that they can't. I've done plenty of people that are, they work out in the gym, feel like they have to go back to the gym as soon as possible, and they'll be back in the gym within days working out, and they just know they're going to be a little more sore, a little more swollen, a little while longer. Medications, we do prescribe Keflex for an antibiotic, prevention of infection. We offered them an anti-anxiety agent before the procedure, Ativan. Probably 80% of my Tickle Lipo patients only will just skip it. They'll just come and have the procedure done without anything pre-op. If we are doing a tummy tuck, then we'll tend to do that because it's a longer procedure. We want them more relaxed. Post-operative pain for our tickles and our tickle tights, we're just giving Tylenol with coating. A lot of patients take that for 24 hours and pretty much stop it. If it's a tuck, we'll give them Vicodin. So return to work, again, with my tickle procedures, they're back to work within 1 to 2 days. If they have a tuck, they can be back to work within 3 to 7 days. I had a patient, one of the patients I showed you on the screen there, who had a tuck, was grooming her horse within 3 days and riding her horse within 10 days. And that's from a tummy tuck procedure. Excuse me. So the results of the healing process is important. Okay, the degree of tissue damage and aggressive suctioning also adds to what kind of results you're going to get, and also just the behavior of what the patient does. So the healing process for tickle, everybody goes through a healing process normally. Inflammatory healing process, proliferative, and organizational. But the thing with tickle is all compressed. Inflammatory process is only about a week long. It's just basically warmth, tenderness, swelling, and bruising. After that, they go through what's called a proliferative process of healing. We just have a lumpy bumpiness under the skin, typically not visible, just palpable. And by the 4th week, they're going through an organizational process of smoothing, lightening, and tightening. So usually this whole process occurs within a few weeks. So that's the real difference with Tickle Lipo, is that we're measuring your healing results within weeks. Every other form of liposuction I used to do, we measured it in months. With Tickle, I'll tell you 3 to 6 weeks. When I was doing Smart Lipo, when I was doing Vaser, when I was doing Body Jet, I would tell you 3 to 6 months before you see end results. And that's a long time to wait to see what results you're going to get. And it's also the degree of tissue damage and aggressive suctioning that helps prolong or shorten the recovery stage. Again, remember, everything else in the marketplace cuts and chunks, burns and destroys. Tickle emulsifies, suction, contouring, sculpting. A lot less trauma, a lot safer, a lot more gentle. The nerves are irritated, so there's some numbness. The blood vessels are irritated, so there's a little bit of ooze. There's no gross blood. There's no cutting of blood vessels. There's no cutting of nerves. In the skin support structures, which you want to stay intact, so those support structures that tether the skin, once the fat is evacuated, you want them to have a chance to pull in naturally on their own. When you're doing something that's cutting and chunking, you're naturally severing those fibers to begin with, so they don't have a chance to pull back on their own. And that's why the garment's worn longer, to make sure the skin stays where you want it to stay. So the fiber support structures, like I said, are intact with Tickle. They're not severed like everything else. That minimizes also the chance of wavy results post-procedure. Once you start cutting and chunking, you get a lot more waviness. The tissue thickness, once we're suctioning, because we're contouring, because we're sculpting, we're going to be pinching the skin during the procedure, and we're going to feel for a thickness. And a two-layer skin thickness, a little bit of fat, should be about 4 to 5 millimeters in thickness. That's called kind of the intraoperative pinch test to say how much fat we left behind, because we want some fat underneath that skin for 2 reasons. 1, to keep it smooth, and 2, to keep the skin looking healthy. Fat or skin without fat looks like parchment. It doesn't look healthy. It looks like it looks diseased. So we want to keep it looking healthy. Finally, as far as the behavior post-procedure, in order to maintain the result, we tell patients, you maintain your weight, you'll maintain the result. Results are permanent as long as you do this. If you lose weight, you'll enhance the results. However, if you gain weight, all bets are off. So tell them you're paying decent money, please at least maintain your weight to maintain the result. So just to recap, again, thank you very much for listening. We've given you an in-depth dive into the world of body sculpting. Hopefully, I've given you confidence and clarity, certainty and hope that body sculpting is the right thing for you or for your patients. I told you I transitioned from an OBGYN to a cosmetic surgeon, and my desire was to help patients with self-esteem, self-confidence, and self-worth to enhance that for them. I'm sure you feel the same way. I showed you my journey. I chose Tickle Lipo and J-Plasma for a reason because I thought that they were superior tools for body sculpting, and the addition of tucks when necessary. I documented for you how Tickle recovery results are far superior to all other forms of liposuction. And finally, I believe I provided for you the proof and my expertise of all things Tickle. So hopefully our time together was somewhat enjoyable. Hopefully you found this valuable, interesting, educational. Did you feel that you're now more comfortable with your body ability to make a decision regarding body sculpting for you or for your patients? Hopefully it's fair to say this procedure would give you more self-confidence and self-esteem and self-worth. And with that self-worth, a better appreciation of self and care of self. So it's time to consider having your patients be more proactive. Because if not now, when? Okay, that's nothing. Unfortunately, exercise and diet only do so much, and sometimes those areas to try to spot lose are very difficult, if not impossible to do without some kind of active treatment. So in conclusion, Tickle Lipo is a superior form of office-based liposuction, liposculpture, if you will. J-Plasma is a superior form of skin tightening. It's the most comfortable and gentle procedure available in the marketplace today. There is minimal downtime, rapid healing process. You get pretty much immediate results, and they're superior results. So I want you to ask yourself and ask your patients, when it comes to body sculpting, why haven't you done it sooner? And why haven't you done it with a tickle tight, or a tickle tuck procedure? So I want to thank you for your interest and your time here today. And I appreciate everything you do just to listen to me. And if you have any questions, now's the time to challenge me. Otherwise, I will hand it over to Jamie.
Perfect. Well, Dr. Zelko, thanks so much for joining us today on our first Advancement in Aesthetics series. I just want to tell everybody on the line, thank you again. MedResults chose to feature or invite Dr. Zelko to speak for this member-focused webinar series for a couple reasons. And the first one being he's an expert in a widely unknown type of procedure, which we felt was really unique to this space. And our goal with this series, where we're highlighting members and what they're doing, is really to expose you guys to new innovative treatments and technologies. And we thought this was exceptional for the space. And number two, this treatment really provides physicians an opportunity to serve an entirely different demographic of patients. So you may be doing lots of different tightening type procedures or contouring procedures, but I think this really serves a group which may have turned to more invasive, expensive surgical procedures. So it's really just another option for you guys to increase your efficiencies, to attract a different demographic of patients, and to keep all of your patients coming back to you for body contouring, and then now, of course, Tickle Lipo. So thank you again, Dr. Zelko. We appreciate your time. If you do have questions for Dr. Zelko, you can use that automated survey, which is going to pop up in just a few seconds here when I power down the presentation. Alternatively, you can always reach out to me directly if you have questions for Dr. Zelko or would like me to connect you to him. And without delaying any longer, we hope to see you at our next webinar presentation on February 22nd with Strata Skin Sciences. And until then, thank you again and have a great rest of your afternoon.